How common is late-onset schizophrenia? Have you ever wondered how common late-onset schizophrenia really is? This condition, which involves the emergence of schizophrenia symptoms after the age of 40, is less frequent than early-onset schizophrenia. Early onset typically appears in late adolescence or early adulthood. Studies indicate that schizophrenia affects about 0.3 to 0.7% of the general population over a lifetime. However, late-onset cases make up a smaller portion of this total. The one-year prevalence rate for late-onset schizophrenia is less than 1%. Interestingly, late-onset schizophrenia tends to be more common in women than in men, especially after menopause. Hormonal factors, particularly the protective effects of estrogen, may play a role in this difference. Women often experience a delay in the onset of symptoms until after they go through menopause. In clinical settings, it is essential to differentiate late-onset schizophrenia from other psychiatric conditions, such as dementia or depression. This distinction is important because the treatment and management strategies can vary significantly. Late-onset schizophrenia often requires a tailored approach to medication and therapy, considering the patient's age and any other health conditions they may have. When we look at older adults, late-onset schizophrenia presents unique challenges. Diagnosing this condition can be tricky due to overlapping symptoms with other age-related issues. However, early diagnosis and appropriate treatment can greatly improve the quality of life for those affected. While late-onset schizophrenia is not as common as early-onset forms, it remains a significant consideration in diagnosing and treating psychiatric disorders in older adults. Understanding its prevalence and characteristics helps in providing better care and support for those who may be experiencing these symptoms later in life.